Hello, everyone, and welcome to Behind the Stigma, a podcast where we bridge the gap between psychology, philosophy, and mental health for everyone. I'm your host, Yara Manova, a PhD student in philosophy of psychiatry, and our mission is to help you better understand yourself and the world around you. Today's topic is on existential therapy, focusing on the work of existential psychiatrist Dr. Irvin Yalom. We'll also be exploring other concepts such as isolation, death, and the therapist-client relationship. Today, my guest is Muhammad Ali Ilyas, who is a clinical psychologist residing in Dubai, UAE. In his psychotherapy work, Ali guides clients on their journey of self-discovery and helps them navigate existential challenges using philosophical and psychological perspectives. He has spoken at platforms such as TEDx events, literary festivals, and podcasts, to name a few as well. Ali is also a neuromarketing consultant and a corporate trainer, applying interdisciplinary insights from psychology and related fields to help individuals and organizations achieve their goals and find meaning in their lives. Well, I am honored to welcome a dear friend, my future mentor, but he doesn't know it yet, and a truly incredible human being. Ali, welcome. This is really, really exciting.
Yeah.
Thank you so much for coming on the podcast.
Thank you for having me. I'm really looking forward to the conversation.
Yeah, me too. You know, it's funny because I was thinking about it. I'm like, this is basically just us.
Stalking.
Yeah, just us talking, except we're limited to 1 hour instead of like 4 hours.
Yeah.
Yeah, well, I'm genuinely so excited to speak to you because I think one of the biggest gifts you've given our friendship is introducing me to Irvin Yalom's work.
Yeah.
And you told me to read one of his books called Love's Executioner, right?
Yeah.
And honestly, I gotta say, I finished that book in a day and it was so captivating. There was so much richness in there. So really, really excited to dive into that. But before we get into, the themes that Yalom explores, I'd love to first start off with who Dr. Irvin Yalom is, and what made you interested in his work.
Yeah, so Love's Executioner was actually the first book of his that I ever read. And The Gift of Therapy, which I know you told me that you recently ordered that. The Gift of Therapy was a book that my professor would tell me about. And it's one of those books that I think he's known for a little bit more because it speaks to therapists and it speaks to patients as well. But the first book of his that I ever read was Love's Executioner. And I'll get to why that influenced me or how that influenced me in a bit. But Irvin Yalom is, as you said in your intro as well, he's an existential psychiatrist. He is a really interesting man because there's been an existential tradition within psychotherapy, psychiatry, psychology. And a lot of people have heard of Viktor Frankl, who also influenced Irvin Yalom.
Sure.
And his own mode of psychotherapy called logotherapy. And Irvin Yalom is also influenced by a bunch of different people, from people like Rollo May, who was one of the psychiatrists who brought the existential tradition within psychotherapy to the US. And I believe it was his book called Existence by Rollo May that really influenced Yalom as well. And he was originally, if I'm not mistaken, I think he was originally trained in psychoanalysis. I know he was in his own analysis. Actually, his poor analyst. Every time he's writing, he talks about how horrible his first analyst was.
That's so funny.
He's never named the analyst, but I feel so bad for whoever they are. But the way he started working with people, so he's known for two things, Irvin Yalom. He's known for having a tremendous influence on, really being one of the pioneers of an existential form of psychotherapy and group therapy.
Right. Yeah.
So group therapy, that's not really something that I've that's not something I do yet. That's something I would like to get trained in the future. That's not something I've explored much. But you can very clearly see the impact of the relationality in group therapy that he brings to individual psychotherapy as well. He often refers to it as the here and now. Different psychotherapies refer to that space. I'll get into this later too.
Sure.
In different ways. That's how he refers to it. And so that's who he is. And he must be in his early 90s now.
Yeah,
He-
93.
93, yeah. So he is probably one of the most influential living psychiatrists on the planet right now. His influence goes far beyond just psychotherapy, and we'll get into his other works too. And yeah, so that's who he is. He was a psychiatrist. He is a psychiatrist in the U.S. who has done tremendous work in the areas of existential psychotherapy, and really he's influenced generations of therapists,
Yeah.
including me.
Yeah.
So yeah, that's who he is. And the other half of your question was, how did I come across him? Or
Yeah.
what was
like,
it that
what of his work influenced you? But I know
Right.
you said you want to get into that later. But
Yeah.
before we do get into that, just want to highlight something and let me know if this is right. So there's different schools of thought, right? Like there's psychotherapy that focus on like, or psychoanalysis, let's say, that focus on the more of like unconscious contents of your mind. Then there's like the behavioral school of thought, like cognitive behavioral therapy, which focuses on more of like changing your behavioral patterns in the here and now. And then there's existential psychotherapy, which is, correct me if I'm wrong, is it more about like finding meaning in your own life? Would that be correct?
So it's really tricky to actually exactly
Segregate.
describe or locate
Yeah.
where where Yalom's existential psychotherapy. He has a whole textbook called Existential Psychotherapy. In fact, in the beginning of that book, in the preface, he draws out a whole map of where it lies according to him. He refers to how this school of thought and psychotherapy are like the cousins of existential psychotherapy, and these are the brothers and sisters, and these are distant relatives and stuff
Yeah.
like that. So he maps it out. But the thing with Yalom's position in specific is that there's no training to become an existential psychotherapist of Yalom's kind. What he's provided is whatever school of thought or modality you follow as a therapist, Yalom provides you with a new way to conceptualize the client and a new way to address topics that might fall through the cracks in other forms of psychotherapy. So that's kind of what he provides. It's not that sort of a full-blown theoretical orientation where it's as exhaustive as, say, CBT or psychoanalysis. It's not like that. He offers models to understand a person.
Yeah.
And you can be from a CBT perspective or a psychoanalytic perspective, an internal family systems perspective, and Yalom's existential psychotherapy can still apply in how you're trying to understand the issues of the people you're working with.
Right, right. Okay. So then how did he influence you? I know he influenced you in a very big way. And it's interesting because as I was reading Love's Executioner, I was like, oh my God, this is Ali. You know, a lot of like our like I see his influence in you, which I love so much.
That's a compliment for me because I have great respect for him. So I think I came across his first book, Love's Executioner, and you read it. You read it in a day, right? You know that first story. The first story is called Love's Executioner, and it's about this lady named Thelma.
Yeah.
And did you notice how in that first story he essentially talks about how he messed up?
Yeah. Yeah.
He's very open about
Because he was judgmental of the guy. I don't, no spoilers for anyone, but.
Not just the guy, but there were times where he felt he didn't really treat the woman properly as well.
Oh, right. Yeah.
Right. And she eventually left psychotherapy, if I remember correctly. It's been a few years now. The impact that had on me as just like a completely new therapist in the field when I was reading that was you feel this pressure to never make a mistake, to always be perfect, to really wear that coat of I know what I'm doing. And you really want to look like you know what you're doing at all times. And I imagine it's similar running a podcast.
I knew you were coming here.
So when I read that, it was so beautiful and it was so human.
Yeah.
And it allowed me to humanize myself and to humanize other therapists too. Because I thought to myself, I think he wrote that book in the 70s. And he'd been practicing for a few decades by that point. And I'm sitting there thinking, so this guy is that open about making mistakes that he made after decades of practice. And here I am a few months in thinking, we should really be doing it right all the time.
Yeah.
It freed me.
Wow.
It freed me in the sense where I started seeing myself as another human being in conversation with another human being in therapy and doing what I can to provide support, provide movement in the direction they want to move in, without being this kind of really just perfectionist or really self-critical, incredibly self-critical when I make a mistake. So I think it allowed me to have more compassion towards myself and my fellow therapists.
Yeah.
So that's what he did for me and for a lot of people, I would imagine.
Yeah, that makes so much sense. You're so right. We always have to, like, we play a certain role and we feel like we have to be perfect within this role. But as you said, like, we are human. It's impossible. And also, it's interesting that you bring this up because I want to talk about a concept known as transference and countertransference, which is something that happens between a therapist and a client. And it kind of goes into what you're saying. It's almost impossible for a therapist, or is it? I'd be curious to know, is it impossible for a therapist to, project onto the client or, transfer some of the feelings or even get triggered by the client and vice versa? Like, does that happen? And if it does, how would a therapist navigate that?
All the time. So the conversation on transference, and for those who don't know, transference is, it's a little tricky to even define, but transference is essentially when a patient is projecting certain things onto the therapist, or they're experiencing some sort of very deep emotion towards the therapist. Countertransference is the opposite, when the therapist experiences those feelings towards the patient. Depending on who you talk to, what school of thought they're from, what modality they follow, transference is going to be understood very differently. The type of psychotherapy that I do, I do a lot more relational work. So what that means is transference and countertransference are always present. It can be in positive ways, it can be in negative ways, and it can be in this entire place in the middle, which is usually where it is. So yes, there are many, many times where therapists will experience countertransference, and they can also really use that to the benefit of the client and themselves. They also have to watch it. They also have to be very aware of what sort of countertransference they're experiencing towards the client. That means they should be discussing it in their supervision or their peer supervision, or if they're in therapy and it's bringing up a lot of really difficult things for them, then they should be discussing that in therapy too. So, yeah.
Wow, that's super interesting. Can you give us an example of, you mentioned relational therapy. So is it possible for a therapist to actually, I don't want to use the word heal, but amend certain parts of themselves as well with a patient? And is that dangerous, or would you say opposite? It's actually healthy.
I'll do my best to answer this question in a way that doesn't get too technical.
Okay.
Yalom actually puts it best when he says, only the wounded healer heals. And what I get from that when I hear that is that someone who is deeply in touch with their pain, and when I say in touch, I don't mean simply sitting and suffering in their pain. I mean someone who is aware of their pain and how it impacts them, and how that pain can at times both help in propelling them towards amazing things, or keep them from doing things that actually help them improve. It's important to know that.
Yeah.
So it's important to know which direction that pain takes you in. I think a small example of this is, so one thing that you discover when you read Yalom is he is very open to self-disclosure. He's open to exposing parts of himself to his clients in really beautiful ways. And self-disclosure is something that's always a little tricky in psychotherapy. You always have to make sure that you're doing it for the client. It should never be for you. Right.
That's right.
Yeah. So I think a good example of this is, for example, my father passed away when I was 8 years old. So naturally, there's a lot that comes with that. Now, it's been decades now since my father passed away. I'm an adult. Now, when I sit down with people and I'm working with people, let's say, who are experiencing a lot of grief and they've lost a parent, I will often, in supporting them and doing the supportive grief work that I need to do, I will also attempt to see when they tell me if they're really relating well to people who have also lost their parents. I will try and make an assessment of whether or not it would be appropriate or helpful to this client for me to tell them that I've also lost a parent.
Yeah.
For them to feel like I'm not speaking from a purely professional academic sense, because that can help the client relate to you more. And in psychotherapy, when all the research that they do on psychotherapy, on what makes psychotherapy effective, the one factor that keeps coming out on top is relationship with the therapist.
Yeah.
So because the relationship with your therapist is the tool to healing. So in a scenario like that, if I've checked and I've maybe even asked someone like that, do you think you feel more comfortable talking to people who have also lost a parent? Do you feel like they understand them? They might say yes. So then, depending on the session, depending on what's going on, I might consider it useful to share that with them.
Yeah.
And often when I do, it deepens the relationship. Not because I'm experiencing that pain now. I mean, of course, grief is something that comes and goes throughout your life. So there are days where I still grieve that. But it has more to do with the fact that this, for whatever reason or for various reasons, this person now feels like I can understand them better than they did before.
Yeah.
And there's a beautiful touch to that.
Yeah.
There's more comfort in being vulnerable.
Yeah. And they start to see you again, like see you
as a person,
not as a therapist anymore.
Yeah.
And I would assume that would even help them heal more, right? Because that person in front of you, you're now seeing them, maybe trusting them a bit more.
Yeah.
There's a different, as you said, deepening of that relationship.
Yeah. Yeah. And that depth takes time, right?
Yeah.
You will not experience the same depth of in any relationship the first time you meet them from the 30th.
Yeah.
You've learned about each other. You've seen where you're very human, where you're flawed, how you get irritable at times, the beautiful things about you, the kindness that you might have in you. And there's a deepening of relationship. There's a building of trust. There's an openness to vulnerability. And there's support. So just like any relationship deepens over time, and if it doesn't, it fades away.
Right.
But just like any relationship deepens over time, so does the therapeutic relationship. How a client interacts with me in the first session versus the 20th is very different.
Yeah. Yeah. It would be concerning, if it wasn't right. Yeah, exactly.
Yeah.
Yeah. It's interesting that you say that. One of the stories that I loved from Yalom's, the short the Love's Executioner and Other Psychotherapy Tales was Fat Lady.
Yeah.
I love that. And it really ties into what you were just saying about like exposing, yourself.
Yeah.
So I don't know if you want to give the background, but basically Yalom had a phobia of like fat people, right? And
and I think it had to do something with his mother.
His
also,
mother,
right?
yeah, of course, yeah.
Yeah, because he had. So I've read
so
like
many,
13 of Yalom's books.
Holy shit!
Okay. So he talks about his mother a lot.
Oh wow! Of course.
Yeah, and so there was a lot going on over there, and then that is where we would say a lot of countertransference coming out towards this woman that he was treating. And I read this years ago now, but tell me if I'm correct. Doesn't the story end by him after she's doing really well and him telling her that I felt very uncomfortable with you because of your weight, and she said, "Yeah, I know."
Yeah, exactly. She's like, "You think I couldn't tell?"
Yeah,
like
exactly.
the way you wouldn't even touch me, and he was like, "Oh, holy shit,"
Yeah.
But she laughed about it, and she was like, "It was so obvious."
Yeah.
It's really funny because you see, I love that story because you even see their relationship grow. And also he said something like, it's impossible, or maybe I'm rephrasing what he's saying here. It's what I took from it anyways, that it's impossible to learn someone deeply and not like them. I.e. like, on the surface, we might meet someone and say, like, I don't like their vibe, or like, this person isn't like, it doesn't get me. But really, really, and that was like what Yalom had towards her. He's like, she's so boring. Like, she just sits there and like, I just can't relate to her. Like, what am I going to talk to her about? And then as the layers come through or maybe it was another story, but long story short, as in the concept is the same, that as the layers start to open with a person, he was like, holy shit, there's so much depth to this person that now I want to learn about them more and more. And then he says like, well, it's actually impossible not to like someone when we go beyond all that exterior,
Yeah.
Did you ever?
I think every person does, especially if you're working with people who have personality pathology, those are people that it can be very difficult to sit in a room with. And in some ways, the psychotherapeutic relationship is unnatural in some ways. And I'll tell you how.
What do you mean?
There might be a lot of people you come across and you might go, I don't want to meet this person again.
Yeah, exactly.
Right? And
Yeah.
that's, again, a very human response. And you would never get to know them.
Yeah.
We do.
Right.
So, because those might be the people who need help most. So if a person is constantly repelling people around them because of the way that they're behaving, because of the way things that they're saying, if they're being inappropriate, if they're being incredibly rude, and if they're showing up with these relational patterns everywhere else, you can be sure they're going to show up in the same way in therapy. So the idea is that if we can change the way they interact with us in therapy, we can change the way they interact with the rest of the world. That is the kind of like bedrock assumption of when you're doing relational work. And I say relational work because there's different modalities, there's different theoretical orientations around it. There's relational psychoanalysis, there's object relations. There are just people in CBT who are taking more of a relational route now. You can infuse these things in different ways in the way that you work.
Right. This is excellent that you brought this up because it was what I wanted to come back to. And I remember when you told me this when we were, of course, having our 4-hour chat. You said, and it really stuck with me, you said that the therapeutic room is a reflection of the individual in the external world. And for me, it's so obvious, but it was mind-blowing for me because then it made me think like, holy shit, everything that I want to work out externally, like I need to like work out in my therapy sessions, but also the way I behave with my therapists is the way I behave with everyone on the outside too. So for example, being overly apologetic is something I do a lot in the external world. And I would be the same with my therapist, and she'd be like, you don't need to apologize. But because she was more CBT orientated and we were going through a different kind of therapy, she was the best therapist, by the way, but she didn't pick up on that, you know, whereas I know when you and me were just having a chat, I kept apologizing. You were like, we were in a therapy session, but the point is you highlighted that. You said, do you apologize to everyone like this? Like, why are you always so apologetic? So you're right. It clocked on to me that, you need to pay, even as a patient, you should be paying attention to these things.
Yeah, but a patient can't know, right? Not everyone is a PhD candidate.
Oh God, please stop.
But so you can't be expected to know. That's the job. That's the role of the therapist. And of course, many therapists are not oriented in this way. And that doesn't mean that their work isn't effective.
Exactly, yeah.
They might be effective in very different ways because we know that the research has showed that all these main forms of psychotherapy that you hear about, they're all effective.
Yeah.
Some are effective for certain things more than others, but they're all effective.
Sure.
So even if someone isn't relational, they can still really help. But for this relational bit, because there are certain people who might struggle more in a relational way in the world, in the way that they relate to others. So those are people who might especially benefit from a therapist who works more relationally.
Yeah.
And bringing that back to Yalom for a second.
Yeah.
So can I go over the stuff that I've read? And I want to tell you a little bit about how he's impacted me professionally and personally as well.
Yes.
So Yalom goes beyond psychotherapy. So first of all, I both understand and don't understand why Yalom isn't spoken about more. I don't get it. He wrote Existential Psychotherapy, which is an incredible book. The beautiful thing about the way that he writes is he writes in a totally non-technical manner. So if you are someone who is not related to the field at all, you can still read what he's writing and understand it. If you're an expert, you can read what he's writing and take away something new. That's a skill.
It's beautiful.
In fact, there's this book about how Yalom writes.
Oh, shit.
Yeah. So there's this English professor who wrote a whole book. It's called Writing the Cure. And he goes over how Yalom even writes, because the way that this man writes it's tremendous. It's truly a beautiful skill. So Existential Psychotherapy is more of a textbook. And then he has Tales of Psychotherapy, which is a series. You read one of them, Love's Executioner. There's two more. There's Mom and the Meaning of Life, and there's Creatures of a Day. Then he's written 4 novels, I think, maybe more. I've read 4 of them. 3 of them are around philosophical figures that have really influenced him. So one is When Nietzsche Wept, and that's a historical fiction about what happened if Nietzsche was a part of psychotherapy becoming psychotherapy.
Love it.
And Nietzsche is the patient in that. And then there's the Schopenhauer cure,
Yeah.
which is amazing because he's made this fictional character who represents Arthur Schopenhauer's philosophy. And it's really he's in a really relationally dead place. He doesn't have friends because he's like this character is a caricature of Schopenhauer's views and perspectives.
Yeah.
And did not seem like a friendly guy. And side by side, there's also psychobiography of Schopenhauer. And then the third one is the Spinoza problem, which is about Spinoza.
Yeah.
And that's also really interesting. That takes on like Nazi Germany and Spinoza some centuries back as a philosopher. And then the fourth one is Lying on a Couch, which doesn't have to do with any of these philosophers that he loved, but obviously has philosophical elements. So you see he really brings in a lot from philosophy and specifically existential philosophy into psychotherapy and shows how relevant it is. And he writes it in a very beautiful way. Usually these are things that are not easy to read.
Yeah.
When you read about stuff like that, it's dense reading. It's usually when I read stuff that's a little more dense, which you have to as well. You might read 5-6 pages and go, I need a break.
Literally.
From my notes and this and that. And he writes in a way where it's
so
a story.
Easy. It's a story.
Yeah. And in fact, his novels they're very unique in the sense they're called teaching novels. I don't know if you've ever heard of this term before.
No.
First time in my life I heard of it was also when I read Yalom.
Oh, wow.
He is teaching, I kid you not, he is teaching therapeutic skill through stories.
Yes.
I've never read anything like that before, and I love to read. I read a bunch of different people, but I've never read anyone who's able to communicate it like that. And then there's his autobiography. It's called Becoming Myself.
Mm-hmm.
And then his most recent book, which was incredibly sad, he wrote that with his wife, Marilyn Yalom, who passed away. And
she did.
She did. And the book is actually called A Matter of Death and Life. And they're writing it together. She passes away halfway through the book.
Oh my God.
And then he's writing about the grief he's experiencing.
Holy shit.
It was moving. And the way this man writes about death, he has a whole book on death as well. It's called Staring at the Sun, Overcoming the Dread of Death, which is a beautiful book. So I really dived deep into Yalom.
Yeah.
And
clearly, you're like, I know when he was born and what his birthday cake is and his favorite fruit.
Yeah.
No, I love that.
I do. You know what was really fun reading Yalom, specifically Becoming Myself. He's been to so many major psychotherapists in the field. He's been in therapy with Frankl.
Yeah.
He's been in therapy with Rogers.
Crazy.
Yeah,
Rollo
he
May
tried
as well,
everyone. Rollo May was the therapist that he stuck with. Rollo May was the therapist that he really stuck with, and then they became friends as well. And he talks about Rollo May and then Rollo May's death a lot as well. So reading him is just like you're getting. It's like he's exploring the field of psychotherapy as he is developing the field of psychotherapy.
That's mind-blowing.
Yeah.
It's actually mind-blowing.
Yeah. Reading him, specifically his journey in becoming myself was almost like reading an anthropological study of the psychotherapy space during the time of his life. And it's, as someone who just nerds out about this stuff a lot like you do, it was really something. You're getting you're getting to hear from a pioneering figure what another pioneering figure was like.
Yeah.
It's incredible.
It's actually incredible. It's so interesting. Before this episode, I was listening to an audio book of his, and I think he was appearing as a guest in a conference or something. And they were asking him a lot of personal questions. He's already in his 80s in this essay or whatever you may call it. And he said exactly what you were just saying. He said that my books, like the gift, whether it's the Gift of Therapy, Love's Executioner, or Mom
and the Meaning of Life.
Yeah, Mom and the Meaning of Life. He said that my goal was that towards every end of every book, there's a moral there. Like he's like, the point is that exactly this is like, I'm not writing a technical textbook. I'm creating a story. He said, when I was young, he said, I used to read a lot of fiction. I loved stories. So his influence was actually fiction because he said he loved reading fictional books. And so it really does reflect in his writing because as you're saying, like, it's almost like you're reading a story, but at the end of the story, you have like an epiphany. You know, literally in every chapter, I had like a aha moment, whatever it may be in that instance, you know? So absolutely. And
no, I think the beauty of reading him is that you open up way more to making mistakes. And here's the thing, you're going to make them either way. But you start seeing that as a part of the process rather than something that is interrupting the process of you becoming a better therapist, you know? And that was powerful for me. And I'm sure it's powerful for most people who read him. What you're saying about fiction and how he read fiction and how that had a tremendous influence and how when he writes about his clinical work, it feels like they're stories, right?
Yeah.
Because they are. But that's what we're doing, right? It is a story of someone that he's working with. It's his story and how these two stories, for some point in time, they came together and in an attempt to re-story one person's story.
Yeah.
And what that patient often doesn't know is that there's probably something happening that's allowing the therapist to re-story for themselves too. Because if you come across someone, you're working with someone who is struggling with something very similar to something you've been struggling to, and you're able to help somewhere along the way, it's impossible for that not to have a tremendous impact on you.
Yeah.
You know, when I work with, for me specifically, I really enjoy working with, I find it really gratifying to work with people who are experiencing grief and experiencing some forms of death anxiety as well. And speaking about death anxiety, I think he was one of the people who really popularized the idea of death anxiety as well. And there's a tradition to that. Before him, it was Ernest Becker, who was an anthropologist, and he was also very philosophical. His book, The Denial of Death, is very, very well known. And he was tremendously influenced by Otto Rank, who was one of Freud's contemporaries. I haven't read Rank yet. I've read Ernest Becker. So there's almost you see a tradition coming down. But the way Yalom wrote about it, I think popularized it a little more. Yalom was heavily influential to a certain group of social psychologists, and they ended up creating a whole field in social psychology called experimental existential psychology.
Right.
That's where then they made a whole theory about death, terror management theory. It has some really good points. Some of them have been questioned, but it's a theory.
Sure.
That's what science is.
Sure.
You theorize something and you see what parts of this can be proven, what parts of this can be supported, and what parts of these need to be amended. So death anxiety is now viewed in a lot of academic research as a trans-diagnostic concept.
Absolutely.
And they've actually done research that's found that it is a core fear in some depressive disorders, anxiety disorders, health anxiety, panic disorders.
Yeah.
So
before we continue, can we define what exactly death anxiety is?
So to put it really simply, it's the fear of death, which every human being has to varying degrees. However, there are times when we say death anxiety, clinically, there are times where your fear of death can become so tremendous that it keeps you from being able to live your life. That's when death anxiety can manifest as clinical. But we all have it. And in fact, if you want, this is something that I usually do. Sometimes I do this in therapy, but I mostly try to do this when I do, you mentioned corporate training. So when I do those, there's usually something about death in there
Oh,
too.
Really?
So
how trippy, how is that like?
So whenever I suggest it, everyone finds it a little odd.
Yeah.
But here's my take on it. When I'm being called by some sort of corporate, I know going in to speak for an hour or two about stress management, if there's 20 people in the room, maybe one of them is going to take away the skills I'm teaching or the tools I'm providing and use them.
Okay.
What I would much rather do is to go in there and have them connect with some part of themselves that they might not have connected with before or they attempt to run away from.
Love
I
that.
can have some sort of influence there to get them confused, to get them thinking. And then when I leave, there's some sort of reflection that can take
Afterthought,
place
yeah.
rather than going in, giving a lecture,
Sure.
here's stress management, blah, blah, blah. Because
Sure.
I'm coming in for an hour or two. How much impact can I really make?
I love that.
Yeah. But when I talk about death, and I'll fit it in somewhere.
Of
right?
course you will,
I'll
Ali.
I'll fit it in somewhere.
Yeah.
When I talk about death, because death anxiety is present in every human being. From children, from the youngest age,
Yeah.
children start asking questions about where do people go
Yeah.
when they die? What's heaven? What's hell?
Yeah.
They'll ask all of these questions about God and theology, and a lot of people are stumped about how to answer that. But death anxiety is something that is present in everyone because death is what Yalom calls an ultimate concern of life. And he says that there are 4 ultimate concerns according to Yalom. There's death, freedom, meaninglessness, and isolation. These are problems of existence that every human being has to deal with. So with death, some of us we might live in communities or societies, or we have religion where we have a lot of support. And some people even living in those sort of communities will still experience clinical levels of death anxiety. So that's very possible. But there are structures that can be created around you to help alleviate the death anxiety, but it's always there. And if you want, we can actually do a quick exercise and if there's people in the audience who do this, they can do this mentally. They can do this on a piece of paper with a pencil. You want to do this?
Sure, let's do this.
So it's really, really simple. And I'll look into the camera for this one to explain this. So imagine that this is A.
A, okay.
A, this is birth. This is B. This is death. And there's a line between this finger and this finger, between A and B. Where do you think you are on the line?
This is life and this is death.
This is birth and this is death.
So I would say I'm somewhere here in the middle.
Somewhere here.
Yeah.
Right. So somewhere pre-middle.
Yeah.
Right? So to a lot of people who are listening or watching, if they do this, how you can do this exercise is go from A, put a line down between A and on the other end of the paper is B, and just point out where you think you are. Was it strange even having to point it out?
It's like, where
Jarring.
am I in my life's, how closer am I to the end of my life?
Now, here's the thing. Here's a scary question. How do you know you're not at B?
Right. How do you know
You
that?
don't.
Yeah.
You don't. Because we're assuming that we're supposed to live the average lifetime, which is a little higher for women than it is for men. It's somewhere in the early 80s, if I'm not mistaken. So it's like, I think it's 82 or 83. So you imagine you're going to live that entire life. We don't really have reason to believe that. There is no reason to believe that death cannot come to your doorstep now, in the next hour, tonight, or tomorrow. There is no reason to believe that. And even as I'm saying it, are you noticing something come up as I say this?
Yeah, of course. Absolutely. To us, we assume that, it's the elderly that are closer to death, or it's someone who may have
sick.
a chronic, or or the sick, which Yalom dealt with a lot too, right?
Yeah.
But then you never think that you're more of your own mortality,
Yeah,
right?
and in some ways, that's necessary.
Yeah.
So some level of denial is necessary, because we're also not suggesting here that a person should be experiencing death anxiety at all times. That would make life very difficult to live.
Yeah.
What we are suggesting is that, because think about it, if you were to fully realize that I could die right now, you wouldn't be able to cross the street.
Yeah.
Everything would start feeling dangerous. So that denial of death is necessary
for humans to continue living.
Just living. Right?
Yeah.
But on the other hand, a complete denial of it can also be
too much hedonism almost.
Too much hedonism, and then you might also do a lot of risk-taking activities.
Sure.
It can lead to a lot of psychopathology.
Yeah.
Again, as research has shown us, death anxiety has a lot to do with a lot of psychopathology. And death anxiety, by the way, conscious death anxiety is more commonly found in women than it is in men. That might be because the world is a much more unsafe place for women than it is for men. So there's a bunch of different ideas around that. So, but the reason that we get in touch with our death anxiety from time to time, if we are someone who never gets in touch with it, is it brings us closer to our values. So this exercise that Yalom suggests to his patients sometimes would be, write your obituary. What are you writing about yourself? Because chances are you're going to write about your values. This is where I personally really like to touch on some work from positive psychology as well.
Sure.
It's a funny stretch from death to positive psychology.
Love it. Yeah, exactly.
But positive psychology does a lot of value-driven work.
Sure. Strength-driven,
Strengths, values,
meaning.
all of that stuff. So for me, I really like to engage with that. If a person is experiencing some level of death anxiety, we flip that on its head and we say, what makes a life worth living for you?
Yeah.
Because we also know that low life satisfaction usually increases death anxiety. And if we can increase life satisfaction, death anxiety also reduces in some cases. So it's complex. It's all over the
Yeah.
place. There's, we'd have to do a couple of hours of conversations to
Right.
really get into it. But at the end of the day, it's nothing new. Philosophers have been talking about the necessity to
Absolutely.
meditate on death for a long time. The Stoics would talk about it all the time. Memento mori, remember that you too shall die.
Yeah.
So
yeah.
so
My motto in life, by the way. I'm not
Yeah.
even kidding.
that's
yeah.
interesting. You would love Staring at the Sun by Yalom.
Really?
It's a wonderful book.
Yeah. There was I feel like I wrote it. Yeah. Are we I forgot which philosopher said this, but they said, are we afraid of death or not living enough? And I think that goes to what you were saying,
Yeah,
right? Like
100%. And I think that for people struggling with death anxiety, consciously or unconsciously, I think that is truly a very reasonable and useful question for us to address in therapy. Yeah.
yeah. It's interesting because I was speaking to a friend yesterday, of course, as usual, on the same topic.
Yeah.
But I was telling this person that for me, happiness seems like a very far-fetched concept. Instead, it's about reaching happiness in life. Instead, it's about accepting suffering in life, but finding meaning within that suffering. So I don't know if this falls into what you're saying, but the way I view it is that if you have meaning in your life, you would be a bit more accepting of not your death, because I'm terrified of death, but you would be more accepting of just the difficulties that life gives you.
Yeah. I would quote Frankl on this one. Viktor Frankl has this amazing book. It's called Will to Meaning. And in it, he talks about happiness, and he says, happiness is not something to be pursued. It is something that ensues. It is something that is not something you attain. It's something that follows as you live a life of meaning.
Yeah.
And so I think that's beautifully put. I completely agree. I think that, happiness is a state that will come and go, but if you're living your life based off of your values and the things that bring meaning in your life, and just quickly, because people derive meaning from all sorts of different places.
Yeah.
In existential psychotherapy, on the portion and meaning, Yalom borrows a lot from Frankl there, but he differentiates between cosmic meaning and terrestrial meaning. So Yalom himself, he's an atheist, but a lot of religious people really, in fact, he even received some sort of religious award for existential psychotherapy.
Really?
He wrote a whole essay about it because he was really surprised. He said,
Yeah.
guys, I'm an atheist. And they said, yeah, well, your book is so religious.
Wow.
And he goes, what?
He's like, wait, what? What's
Yeah.
that? That's hilarious.
Yeah, he has a whole essay on it. It's really
yeah.
interesting. So in it, he differentiates between cosmic meaning and terrestrial meaning. And cosmic meaning it comes through religion, and there's theology in it, and it's God and all of these things. Terrestrial meaning is something a person can have without having cosmic meaning. But if you have cosmic meaning, you also have terrestrial meaning.
Oh, wow.
So, but if we are living our lives, wherever a person might lie in terms of their faith, in terms of their belief, if you have a sense of meaning and you are living up to your values, happiness is something that will ensue every now and then. Yeah.
Right. That's super interesting. So how much do you think one should be thinking about their mortality? Because as you said, too much of it causes anxiety, and it can reach to such a point where a person doesn't want to do anything anymore. It's like complete apathy. And then on the other side, it's getting into like not thinking about death at all might succumb to us being more, falling into pleasure side of things, and that's where I think maybe things like addictions come in and constantly seeking that like dopamine rushes, as they say nowadays. Because again, I think that too little of awareness of one's death can cause a lot of these, I would say, hedonistic lifestyles, So where would you say one would have to, like, how much should we be thinking about our mortality?
I think enough that it doesn't overwhelm your defenses, and not so much that it ceases to exist as a concept in your psychic realm. There's really no easy way to answer this, but there are, for example, when we experience loss, we experience, again, what Yalom would call an awakening. It is an awakening to the idea that we and those that we love are mortal. And that can be incredibly transformative while being incredibly anxiety inducing.
Yeah.
So for people who have experienced a lot of loss in their life, death anxiety can come as a real challenge because it might be something that's too present in their lives. For people who don't experience a lot of loss in their life, or for people who generally do not think much of death or don't have a lot of awakenings, death might be a purely intellectual concept. And that's where I'll draw a line between intellectual insight and emotional insight and what it really means to know. Often we will talk about something as though we know, even though we just understand it intellectually. How often so often I come across people who'll say, therapy, oh, I already know my problems. I'm very aware of my problems.
Yeah.
Well, where's the change? Do you really, to know and to not change is not really know.
Yeah.
So awareness is necessary for change, sure, but it's not
It's only
on
half.
on its own, it's not enough.
Yeah.
Exactly. Yeah. So, but when you have emotional insight of mortality, it can be, and it will come in moments again, because our mind also has to work to suppress that awareness because it's very scary to be feeling it all the time.
Yeah.
So your defenses need to do their work. But sometimes there will be, the anxiety will be so great that it overrides your defenses and they're not working. And that's when people might start experiencing something that looks more like psychopathology, where they might need professional help. But yeah, if you don't experience a lot of psychopathology, then it would be useful, necessary, and important to meditate on death every now and then. Yeah, in whatever way you choose to.
Recently, never have I had this before, but I've been having this fear that Elfo, my partner, is gonna die. And like, I don't even want to say it because I'm like scared to put it out in the universe, but he's a pilot and my biggest fear is flying. So we can put the two and two together. So there's just been such and I think the more I love this person as a human, like I don't want that person to get hurt or, so it's so random. Like I've never had it. I'm going to blame Yalom because after I read his book, I'm like, it's been in my head, but
it touched on something that was already attempting to penetrate the surface.
As always, you nail it. Yeah, exactly. And it's just been there a lot. And it makes me really sad also because I'm like, my poor parents, like rather than worrying about them, I'm worrying about, this dude. But yeah, but it's, it's my thoughts. You can't control it. But yeah, like that anxiety is real. And like, it's interesting because it's the first time like truly I've ever been worried about someone else's death over mine, because I've always been very fearful of my own death, but I think this was the first time I ever experienced fear of someone else's death. And
it's so important for us so I think one of the things that happens when you think about your own mortality or mortality in general more often is you become very comfortable with those conversations. I'll tell you a story. So my aunt passed away in 2019, and she was in her mid 70s, I believe. And she was a woman who had gone through a lot, and she'd really triumphed over a lot of really difficult periods in her life. And I'm close to her children, who are my elder cousins as well. So she needed she passed during a heart procedure. She needed stunts. And what happened was a day before her heart procedure. So I've experienced, one, you can see how much I talk about this. So my family's gotten comfortable talking about this as a result of that.
Oh, wow.
And I myself have seen a lot of loss in my life. So it's something that I've become more comfortable with through my own work, being in therapy myself, the work that I do with my patients, and processing my own loss, which is continuous. So I was sitting down with my mom and my aunt, and we were talking about how my grandmother was buried very far away in the village, and none of us got to visit her grave often.
Yeah.
And my mom and my aunt were complaining about that. They were thinking, oh, if we had thought about it a little bit more, we would have buried her here in this city. So my aunt lived in Lahore, which is a city in Punjab in Pakistan, and my family and I live in Rawalpindi. So they're about 4 or 5 hours away from each other. So my aunt was getting all this stuff done in Pindi. So we're having this conversation, and I just think to myself to ask my aunt, where would you like to be buried? Now, that's not a question that people are comfortable asking or answering.
Yeah.
But we were really shocked when my aunt said Pindi instead of Lahore, which is where she lived for decades.
Yeah.
Now, had I not had the comfort
to
ask her, we would have probably had her buried in Lahore, which would have been against her wishes. So the beauty of having been able to, it wasn't a big procedure that she had the next day.
Yeah.
But I'm so glad I asked.
Yeah.
Because when I asked her, she actually got to be buried where she wanted to be. Because otherwise, that's not something anyone would have asked, or maybe she wouldn't have even voluntarily said.
Yeah.
Because we are uncomfortable talking about deaths, even though we know we're all going to die.
Yeah.
And that's why it's so important. I've seen people whose family members are suffering from terminal illnesses, and they're not comfortable talking to them about death.
Right.
And it's so important. How can you not?
Yeah.
But that's what happens. That's what happens when your defenses are so high that you can't let that enter at all and make it a meaningful part of a conversation with the person you love, when that is probably the one person you need to have it with most.
Yeah. Thank you so much for sharing that.
Welcome.
I think that's a very important message. By the way, in Azerbaijan, it's crazy because people just always go like grave shopping almost. Like I feel like in Azerbaijan, the concept of death is weird.
Yeah,
like,
some cultures value it a lot more.
Yeah, like literally like
grave
everyone
shopping.
has, like as in like everyone goes and buys their place, which I find insane.
Interesting. So is the culture generally more open towards conversations around death? There must be.
I think so. Yeah, now that I think of it, they are.
I think that's beautiful.
You think, yeah. We always find it very shocking because we're like, they just have it so nonchalantly, like, oh, I just went, bought my place for the grave for me and X and X and Y and Y. And I was like, oh, okay.
You didn't grow up there, right?
I did not, yeah.
Do you think if you grew up there, it would have been a norm for you?
Probably, yeah.
Right?
Probably. Not that I think they're not afraid of death. I'm sure they
of
are,
course.
Yeah. But the conversations are quite open in that sense.
No, everyone. Again, someone who is not scared of death is also someone who will experience psychopathology. So there are very few people that are not scared of death. Those that we see who consciously report that they're not scared of death, they might also experience psychopathology because to some degree it's also meant to protect you.
Sure.
So that you don't engage in harmful, damaging, self-destructive behaviors.
Sure.
But not being so scared of it that you can't talk about it is really important.
Yeah, death denial, basically, yeah.
Yeah, again, death denial is tricky because it's
Oh,
partially necessary,
Okay.
but also at times necessary to overcome.
Yeah, right.
Yeah.
I'd be curious to ask you, if someone is having death anxiety, how would one cope with it? And if you yourself ever had it and how you managed to cope with it.
Yeah, well, with how much I talk about death anxiety, obviously I don't have any.
Yeah, exactly. I was like, you're like way past that now.
No, I'm kidding. I have tons. I've had tons in the past. And it's something that I think I continue to work with. It's an ongoing process. It's not one of those things where you're ever done. So yeah, I mean, I've definitely experienced a lot of death anxiety myself. I continue to. It's an on and off thing. It's never something that you're ever going to be done with because depending on what happens in life, who you lose, experiences you go through, it's going to go up and down. Yeah. It's a natural. It's a part of being human. Is mine to the level of? There's a difference between that sort of death anxiety, again, the clinical manifestation where it becomes pathological. For someone like that, the reasons are mostly found in their history. So it's really difficult to say why a person might experience that. That's something, and again, I don't want to paint every psychopathology as originating from a fear of death. I'm not doing that at all. I'm just saying that when it is present and when it is there, it needs to be addressed in respect to that person's specific history.
Okay.
Like all things. So yeah, that's, we don't have enough time. Otherwise I'd dive deeper into that, but that's what I'd say on that for now.
Okay, right. And if there's any like a quick way if someone's experiencing death anxiety in a moment? Would there be anything helpful that you would say to them to like deal with it within that?
Well, other than the usual regulatory skills,
Sure.
which is really learn how to regulate yourself, learn self-soothing, get in touch with what your values are, notice the trigger for where the death anxiety is coming from, see if you can address that, and also ask yourself if you are living a life that you feel is worth living right now. Become a little more curious about your death anxiety. If the anxiety is so difficult that you're having a hard time just doing day-to-day activities, go to a professional. Go to a professional because they will help you understand where this is coming from.
Right.
Because if it is that severe, it is that clinical, there's probably some cause in your history. It could be trauma, it could be other mental health issues, it could be loss, it could be some people have seen war, some people have seen some horrible things. So if possible, get help if it's to that extent. It would be very useful to go to a therapist for that.
Right. Thank you so much. Well, Ali, I am wary of our time. So unfortunately, the episode is coming to an end. So I guess as a final question, I'd like to ask you if there was one thing that you would say that Yalom has taught you in your personal life, what would that be? And then I'd love to also know if anyone's interested to reach out to you, how could they, what's the best way to find you?
Just to quickly answer the Yalom question, a couple of things come to mind. First, reading Yalom's stories, you almost feel like, oh, art imitates life.
Or imitates life.
Art imitates life. Because he is writing about very real stories of real people, and you read it as a piece of art in the form of literature, and you're thinking, wow, this is beautiful, forgetting that you are meeting these people every day. So there is beautiful art around you in the shape of people. If you can drop down your walls, if you can become a little more authentic, I think that's something Yalom really taught me, to be more authentic, not just in my work, but also in my life, and really be seen for, at times, the mess that you are. It will invite the right people to be in your life. Everyone has their own mess, and we walk around trying to hide it to the best of our abilities. And those of us who are really successful at hiding our mess, who are the hardest to get to know, are the people who are usually the loneliest as well, because they don't know how to let anyone see them. So I think Yalom, in some ways, really taught me how to allow myself to be seen, and that to truly allow yourself to be seen creates the bridge for you to see the other person. And so that's what I would say. And as far as psychotherapy goes, I work at a place called Connect Psychology in JLT. If anyone wants to check out my work, you can follow me on Instagram at The Person and the Therapist, and I'm also on LinkedIn. And if you would like to book an appointment, you can also email me at ali@connectpsychology.ae. So
Wow, amazing. And I'll be linking all of those details on the episode description as well. Ali, this has been awesome. I feel like we have not even touched the surface. So there's so much I want to explore, more about meaning and authenticity, like really what that means. So I'm looking forward to a part 2.
Me too.
Thank you so much for coming on.
You're welcome. Thank you for having me.
Thank you, everyone, for tuning in and listening. If you did like this episode, then please do subscribe to our channel, Behind the Stigma, either through Apple Podcasts, Spotify, or anywhere you listen, really. If you're feeling extra kind today, then feel free to drop us a review, as your support really helps us grow. You can also follow us on Instagram, that is at Behind the Stigma Podcast, and email us on behindthestigmapodcast@gmail.com for any queries or to collaborate. Thank you guys so much for tuning in, and we'll catch you in the next episode.